I want to congratulate the member for Inverclyde for securing this important debate, but I also want to thank all members, not just for their contribution, but for sticking with us on this very disturbed debate, and congratulate Mrs Ryan on steering the ship through to a safe end. On this side of the House, we make no secret of how disappointed we were by last year's drug strategy. We waited nearly 2 years for it and, quite frankly, expected something more radical, more substantial, and certainly something with more funding. There is no amount of gloss that can hide the significant problems with the government's approach to drugs since they took office in 2010. Ideological and plagued with irresponsible cuts. All of today's members have expressed the truly shocking scale of the problem. The UK now has the highest recorded level of mortality from drugs use since records began. There are record numbers of deaths from morphine, heroin, and record numbers of deaths from cocaine use. There are more deaths from overdoses than traffic accidents, and an ever-increasing incidence of HIV and hepatitis transmitted via unhygienic injecting. Drug consumption rooms have operated in Europe for 3 decades, most notably in countries that have had a great success in reducing drug deaths than we have. And even if this government is misguided, they won't look at evidence from other countries. I would have hoped that they would have taken the advice of their own advisory council on the misuse of drugs. In 2016, in response to these unprecedented drug deaths, they recommended that the government consider the introduction of drug consumption rooms. I believe the response was that, and I quote, "It is for local areas in the UK to consider with those responsible for law enforcement how best to deliver services to meet their local population needs." Now, I agree that the local authorities are best placed to deliver such services. However, when responsibility for alcohol and drug treatment was transferred from the NHS to local authorities in 2013, this signalled the most significant and problematic change to funding. And whilst I'm not criticising our overstretched local authorities, the transfer of responsibility brought an end to ring-fence budget for drug treatment, resulting in reduction of services. In an ideal world, no one would take these harmful substances, but we don't live in an ideal world, and therefore we cannot base life or death decisions on ideology. We have to go with what works. And if the evidence is clear that these drug consumption rooms prevent overdose deaths and the spread of disease, then we at least need to trial them. Glasgow was set to do this until they were blocked by the government. Now, I know my honourable friend's main purpose for calling for this debate is to call for devolution of drug legislation to Scotland. But the drugs problem is UK-wide, and we need a UK-wide solution. I, like many, am uncomfortable with the uncertainty we often find ourselves in when it comes to drugs and the law, between legal highs, more widespread drug use, changes in legislation in other countries, decreased prosecutions for lesser drug offences, and even festivals like Glastonbury offering drug testing facilities. We have been sending mixed messages for far too long. We must address this before we are to move forward in a meaningful way. On this side of the House, we are clear. The ever-increasing spread of disease and record number of deaths from drug use is unacceptable. It must be dealt with as an urgent public health issue. The government must take responsibility for this and must review legislation as priority.